But I'm the first one to hear that something didn't work. I don't know why, but anyways.
My name's Alan. I have Crohn's disease. My twin sister has Crohn's disease. My older sister has irritable bowel syndrome. And it was first I believe I had it in my early 20s, and it was first diagnosed when I came over here in So I came in 1989, it was diagnosed early 90s. And they put me straight on to medications. I'm very against medications, but I didn't have much of a choice. In fact, I really didn't believe in them, so I stopped taking them, ended up hospitalised. And from that moment on, it kind of went downhill. They put me on steroids, prednisone, and that affected my bones, my bone density. But, you know, I went back on the medication. I managed to live with it for, up until about, I would say, a year and a half ago. And then all of a sudden tests came back and they said that there were things that weren't right, and so they took me in for surgery. So I went on beginning of May, and they did what's called a bowel resection. And, my main concern, I didn't, this lady here says she has a bag. That was a prospect for me. But fortunately, I didn't need one. However, really, there was no after the surgery, there was no aftercare, there was no, this is what you should do, this is what you shouldn't do. It was just back onto the same medications, one after the other. I'm currently on, I think, 4 or 5. And so I really wasn't doing too good. And I was disappointed. I thought this major surgery would fix things, and it didn't. And so I came about, I think it was a month ago, was it? When did you do your last talk?
I guess a month, 6 weeks ago.
4 or 6 weeks ago. And I sat where you're sitting if you're here for the first time, and I just thought everything made sense. I'm very much against taking medications. But, the specialists don't, have you ever heard a specialist recommend a supplement? Because I haven't. And you get one side effect leads into the other side effect, and they give you a drug to counteract this drug. And I don't know about you, when you go into the pharmacy and they talk about, you ask them whether they'll interact. Okay, so they might know maybe this one doesn't interact with that one, but once you get 4 and 5 in the mix, how can they possibly know all the combinations that are going on? So I went on to this program with these products here, and initially I didn't notice the difference, but I've noticed certainly the last week or so, I've started to take a step forward. Not a huge step, but enough to give me the encouragement that, hey, you know what, there should be, there's something in this. Yep. And so my goal is to wean myself off, along with Paul's help, get off those medications, because nobody's ever told me what's causing it. They just treat it, find the cause and cure it.
Prevention.
Yeah, there's no prevention at all. So anyway, that's my story, and
I'm glad to hear you're doing better.
Help somebody.
Now, before I forget that, I just want to show Alan, because I really apologize for not getting back to you. I've had my computer hard drive crashed, that broke. Then the other computer that we hooked up to has got a major virus, so both of them are in. So it's been about 2.5 weeks, and I got probably 140 emails that I need to answer, and on there are a whole bunch of the phone numbers to call back to people who left messages. So it's been an interesting time with my mother-in-law and the 3 dogs and everything else.
You got to give the computer essential fatty acids.
It does. It needs some. But I just wanted to show in your case, Alan. Okay, this enzyme here, and it affects cancer and everything. But this enzyme called the delta 6 converts these good fats, the parents, cystolinoic, alpha-linolenic, which we're not getting in our diets, by the way, we're getting dead ones up here. It's called processed food, okay? But it converts it into these things that then regulate Oh, bowels, kidneys, amount of calcium in the cell, out of the cell, opens up the blood vessels, regulates your blood pressure, controls pain. Sound like fibromyalgia? Sound like blood pressure problems? This here is also impaired by diabetes, so when you go around it, the diabetic problems mostly go away. Crohn's, without question, because of the work done by Dr. Patricia Kane, who was schooled by a guy named David Horobin. Okay, and she's one of the heads now. John Hopkins is where she runs out of, and they have the biggest database on fatty acids on the general population in the world now. There's no question that Crohn's is faulty delta-6 desaturization. That's impairment of that enzyme. It is not converting enough of these fats so that they can make traffic cops that tell you when to do this and when to do that at the cellular level. Just picture it, in other words. It's like the electricity's out and there's no red light, green light, or whatever, you know, at the cell. Well, is there chaos? Well, what do you think happened in Toronto when there was no power in the West End for thousands, okay? People have a bit of a problem when you come to an intersection. And this is no different than what's been going on in you and Crohn's. Now, I wanted to get back to you, but I've been so busy, but I want to say this. You have to get off, immediately get off the drug that you're on for osteoporosis. It will kill you.
Yeah, I don't think.
Those drugs, they absolutely know now, 3 to 5 years on those drugs, and they're called biophosphates, okay? And I think the biggie was, that came out first, was Fosamax. But the others, you were Actonel, was it? Okay? There's a whole group of them. They work by blocking the body, okay, from replenishing, this is through the osteoclasts and osteoclasts, block the body from removing the calcium when the bone gets dead. I mean, our bone tissue is live tissue. It has to be replaced every day with what you eat, like everything else in our body. What these things are doing is they're stopping this replacement. So what would happen is, on an X-ray or a MRI, there would be no loss in bone deterioration, but the bone that was there was all dying. But this wouldn't show up because you're not measuring whether it's alive or dead, you're measuring density. So it will stop the loss of density, but what's happening now is 3 to 5 years out on Fosamax, a whole bunch of women and men going into their dentist, their jaws were disintegrating. So this is now listed as a side effect of Fosamax, that your jaw will probably fall apart.
Right.
This is not a good side effect. But now what's happening, 5 and 6 years out, is people are walking and their legs are breaking in half just from walking in the thigh. This has even happened to a number of doctors now. And lawsuits are everywhere. So there's no question that this drug, this whole class of drugs for osteoporosis, and there's millions. You all got dozens of friends on these things. These things long term will absolutely destroy your bones. But you know what they're thinking of doing? Because you don't see the inside, and you don't understand some of the science. They are thinking of using this drug now, because of these findings, for bone cancer. Do you know why? Cancer can't live in dead bone. So at the sake of, they sit there and they take the science and they look, okay, well the bone's dead, but they're not going to fall apart for 5 or 7 years. So if we give them this, the cancer won't get them. They'll just collapse in a heap in 7 years, but at least they got 7 years and we can sell them this. Do you see how the system works? And I'm telling you, some of you probably go, or friends of yours in Oakville here, go to one of the biggest osteoporosis gurus in Canada, Dr. And I'm going to tell you a little story from the 90s.